Hello, everybody. We are back. I hope that you've missed us because we have missed you. Welcome back to Curated Conversations. This is episode 4. Very special episode for us today. Curated Conversations with GRAAHI. We're your hosts. My name is Kaylon.
I'm Calvin. Hello.
You see it. So one thing we understand is that health can be a daunting topic and discussion to tackle alone. Curated Conversations is a podcast by the Grand Rapids African American Health Institute, where we focus on our models of care, community, advocacy, research, and education. And through that model, we hope to benefit the community in which we serve. Come along for the journey as we take a deep dive into health topics alongside you.
You really are that good, huh?
I really am that good. Internal joking between us, I kind of flipped the script a little bit, and that was just off the top of the head. You know what I'm saying?
Love that.
Shout out to my guy, Lil Wayne. You know what I mean?
You know,
get a little culture. Today, like I said, is a very special episode. We want to introduce you to Dr. Darla Bishop.
Hey, everybody. I'm so happy to be here.
How are you doing today?
Oh, I'm excellent 7 days a week.
Good.
Hey.
Let me tell you, she's been smiling since we've met earlier today.
I'm a happy person. I have a good life.
That's good to hear. That is a blessing. What are we here for today, right? Today, we're going to take a deep dive into a topic that affects most, if not everyone. And those topics are insurance, health insurance to be more specific. And we're going to teach you about a little bit of the background history of, where insurance kind of came from. And then, why was there a Medicare and Medicaid, and some of the risk and benefits that are involved with both insurance policies, I'll say. So again, we thank you all for being here. Let's get this thing going.
Let's send it off. Perfect. So to start it off, obviously, I think it makes the most sense for Dr. Darla Bishop here to give us the scoop. 5 minutes of who you are as a person, your professional career, all that. Yep. Whatever you can squeeze in 5 minutes.
Ooh, 5 minutes. How about?
Hey, we'll give you 10 if you need it.
That's a lot, actually. You know, I'm working to not talk so quickly so that people can keep up, because sometimes I talk fast. So, Hi, I'm Darla Bishop. I'm originally from Detroit, currently living in Lansing, Michigan. I have a doctorate in public health, where I studied some very specific payment models in Medicaid. Now, I just got this doctorate about a year ago, but I'll have it forever.
Ain't no just got. She's a doctor, baby. Let's go.
But I'll have it
Life and legacy.
Yeah.
Life and legacy.
Put it on the tombstone.
That's right. But I'll have it forever. So that's all that matters. But how I got here is growing up in Detroit, we had our share of all types of good and not so good times. And I do remember that we had Medicaid at some point. And at that time, Medicaid came on you got this little blue piece of paper, with that printing on it. And it just had your name, your date of birth, your address, and it said, Darla, Medicaid, and then had like a little checkbox if you were allowed to go to the dentist. And I remember getting ready for school one year and needing to get our eyes checked, because they said, oh, please go get your eyes checked before school starts, because we won't do eye exams until later in the year. We want to make sure your child can see the board. And us going to either 2 or maybe even 3 different eye stores, the ones you see everywhere. I don't want to mention names because,
right. They're usually somewhere up the street, or a friend knows of them. You can point to it when you're driving past.
Right. Or it might be inside the mall.
100%.
But us having to go to like 2 or 3 different of these eye stores to find one that would accept our Medicaid, just so my mom could get a really simple eye exam done for us kids.
Right.
And I remember thinking like, well, that's not fair that we've had to go to all these places just because the test only took a few minutes.
Right.
It's like, okay, look in this thing. Which colors do you see? Can you see this dot? Name the animals. And then I also remember once we finally found the one that would accept our little paper Medicaid card, my sister, it turned out she did need glasses. And, in those stores, they have the 3 or 4 big walls of all types of glasses, right? Different shapes, different colors. And they usually have a little smaller kid section with like fun stuff like pink and purple, or they have like a fun shade.
Looks like somebody customized them themselves.
Yeah.
Yep, I've seen that.
And I remember my sister getting so excited to go pick out her glasses, because I think she really wanted to wear glasses. And they brought us this little box of ugly frames that we could get because we had Medicaid. And I remember my sister being like, well, at least they have my favorite color. but I could tell that she was disappointed because she was like actually really excited that she was able to get glasses. And I don't know if she was excited because she just thought glasses were cool or because she really couldn't see. Yeah. And so she was excited to be able to see.
It's almost like you're getting these lists of options as if these are really your only options. And it's not being told to you that this is really just based off the insurance that you have right now.
You know, and this was, 25, approaching 30 years ago. So I don't know that we were thinking like that. We're just like, oh, man. Like, we were excited to get glasses and we only had a couple options, right? And so that made an imprint on me, right? I can still tell you the story. I remember the feeling of being in the store and like having to take a bus to get to a different store because that store couldn't take our insurance, right? And so when I went to college, I thought, because you only give kids a couple of options, like, what do you want to be when you grow up? I'm going to be a doctor because I knew that was going to be my way out the hood, right? I was going to be a doctor.
100%.
I wasn't good enough at arguing to be a lawyer. So I was like, oh, well, I'll be a doctor. I've got bad handwriting and everything.
I was looking into being a doctor too. They told me how many years of school, and I was like, that's why they're doctors.
Yeah. That part didn't scare me. So when I went to U of M from Detroit, U of M Ann Arbor, go blue, I was taking organic chemistry. I was having a real hard time. And one day, after leaving that big lecture hall with probably 200-300 students, I saw this table on the diag. I don't know if you've ever been to the U of M campus, but most campuses have this kind of spot somewhere in the middle of the campus where people have to walk around and they do festivals and they have tabling. And on this particular day, there was this Public Health Student Association. And I was like, oh, I wonder what that's about. So I go up to the table and say, oh, what is the Public Health Student Association? They're like, oh, we're students who are interested in public health. And I was like, oh, well, I'm pre-med. And they were like, oh, we have a lot of pre-med students, because the cool thing about being a doctor is you get to help patients and their families, like one-on-one, really help them get their health together, recover from an illness. But when you're in public health, you get to do that for whole communities and countries. And I was like, oh, I can do that's let me sign up.
Scale, impact is really there.
So whole communities. I want
not just persons.
I want to do that. So then I joined the Public Health Student Association and decided, like, okay, I'm going to be a public health person. I don't really know what that means. And when I told my family, they're like, what you mean you're not going to be a doctor? I said, well, don't worry. I'm still going to work in health. It's just now I'm going to change the health of communities, not just individuals, not just families. And so they came along. I went and did a master's of public health focusing on health education, and then did research for a few years and had the opportunity to move to Washington, D.C. and work for Senator Stabenow, who's actually retiring soon.
Oh, wow.
And worked in the Senate at a time that the Affordable Care Act was causing a lot of trouble.
Oh, wow. It was a busy
Congress.
time then.
Yeah, to the point where we actually had a 13-day government shutdown because of some of the provisions of the Affordable Care Act.
What year was this?
This was 2013.
Okay, I remember this because I was going into the military, or looking to go into the military at that time. And I think when there's a nationwide shutdown, military people were not getting paid.
That's right.
So there was a time where I was walking in my recruiter's office and everybody was stressed out.
Oh, yeah.
It was a super stressful time. But that's just goes, like, it's so many layers that can get impacted just through public health that's right. That even connected to me at that time. So it's interesting to think about.
Yeah. And so at that time, I was actually working as a lowly intern. Even though I had a master's degree, I was new to DC and was just looking for a way to figure out DC, because DC is so different than any place I'd lived in Michigan in terms of what it means to work there, what it means to be a professional there. And even though I had all this education and skills, I just wasn't exactly sure where to take them. And so thanks to networking, someone who I knew from college was like, oh, well, I work in the senator's office. If I can be helpful to you, let me know. And I was like, actually, could I be an intern? She said, yeah, but internships are not paid. I said, I think I can do that for like 4, 5, maybe even 6 months. But like, where else could I get this kind of experience? And I happened to be in a stage in my life where not making a main income, because I always had 2 or 3 jobs at that time, like, was going to be okay. I was like, well, I got my waitressing job, I can do this on the side. So like, yeah, I if you think they'll let me be an intern, I'll go be an intern.
I want to sit in this moment for a minute, because even for me, I don't have a degree. So I had to kind of look at life like, where can I invest my time and my energy to get around these people and spaces? And even for the young people that are out there listening, you know, there are maybe opportunities that present themselves that can be investments into your future. And it's not always tied to the money, like you said. So it's kind of like something to think about, you know, if you are young or just in general, you're trying to get into those new spaces, it's okay to align yourself with the people and spaces that exist.
That's right. And, you know, I had a professor who told me there's two ways to say it. Network is your net worth. So who you spend your time with, who pours into you, who you spend your energy around is what helps to determine how much money and resources you have in your life. But also network or not work. Because when you have good relationships with a lot of different people working in a lot of different places, then when you get into a situation where you've moved into a new city and you only know a few people, that could be exactly the thing you need to get that first job or that first internship or that introduction. And so don't be afraid to remember people's names and where they are and what they do.
It's the little intangibles and pieces. It's also like those small connections that you've made. You could have met somebody at the gym and then ate lunch with them, you know, their family. This person works in a whole nother state, in a whole nother industry. Like you said, never be afraid to reach back out and say, hey, this is what I want to do. I don't even know if you can help me, but I want to put myself out there.
Yeah,
absolutely.
And you also never know where people will end up. So you might have met them at a point where they weren't doing much. You know, like people who knew me at that time were like, oh, okay, you're an intern. You're an unpaid intern. Okay, well, I'm a doctor now.
Hello. And that's part of the whole story. And that's where the point now, like, I feel like, you know, you set the tone for this entire podcast. And the tone that I want to actually identify is passion. And as well as passion is the persistence to believe in yourself, to know, like, you know, your value, your birthright, as Vanessa, our CEO, always speaks to, knowing your birthright and working in that. So I want to say kudos to you, and to see where you're at right now is even inspirational to us. And I'm sure for those that are watching, you will see Dr. Bishop's information here. So never be afraid to reach out to anybody. If they're inspiring you,
for sure,
reach out. You never know what can happen. Put yourself out there and live in your birthright 100%. Whenever you're
so
ready.
I do want to mention that I am a member of the GRAAHI board. And part of the reason I kind of volunteered, squeezed my way in, found Vanessa and was like, do you need a board member? I saw you had some openings. Is because I really care about the health of communities, especially communities where Black and brown people live. And part of that is because of my experiences living with Black and brown people and having those little hints that we could have a different life. We could be healthier. We could be happier if we just had a little bit more resources, if we just had a little more knowledge and then knew what to do with that information.
With that knowledge,
right. And so that's why I wanted to be a part of what GRAAHI is doing, because of the more than 20-year history of what the organization has done, not only in Grand Rapids, but in Greater Kent County and around the state.
Yep. And that's where we appreciate you sitting on our board. You bring a lens and an insight that's needed and appreciated in the community. So when you're seeing these programs and things running and they're coming out of the GRAAHI, it takes a family, as we call it. So even with Dr. Bishop sitting on the board, she's taking a look at a lot of these projects and really pushing us on the ground to make sure that it's really going to benefit everybody that we're serving. So I just want you all to know that you may see us in the community, but we're a byproduct of Dr. Bishop's thoughts and plans and energy as well. And it flows just like that. Where I do want to shift now is kind of getting into the meat and potatoes of why you're here. And that is the daunting topic. And I call it daunting because that's what it is.
It's
even
daunting.
For me. I've had insurance for a long time, but if somebody asks me a question about my insurance, you may not get an answer. I'm going to tuck my tail. Let me tell you. I don't even know sometimes.
Let me tell you a little personal experience I have with insurance. Right?
Run it. Go ahead.
One of the scariest moments I had in my life, I think, was my 26th birthday. You know, having to figure out my own insurance coverage and all that stuff. Yeah, literally. Obviously, big appreciation of my parents, you know, taking care of me and having me under their insurance and stuff like that. But, I mean, a lot of those nuances and information about insurance in general had made no sense to me whatsoever. Because I'm like,
Mommy, I don't feel good. Can you call the doctor?
I'll set the appointment. Just go at this time.
My mom's
don't worry
just like,
about
make sure you bring $15 to pay for that copay. You know what I'm saying? So that's all I ever knew about like what health insurance really was. So just the fact that, I mean, I would consider myself a relatively knowledgeable person, or I like to I like to think so.
Dr. Bishop, I'm going to cut him off because he says a relatively knowledge person. Calvin is the type, when we're driving on lunch and he looks at a building, he's like, did you know that building used to be something else back 20 years ago? Did you know that they changed the bricks on that back in 1955 and now it operates like this? He literally knows everything.
Okay. Now I have to ask you a question.
Checker.
Now I have to ask you a question. Ahead. Okay, I do the same thing, so that's why we get along so well.
Yes. Okay.
Okay. Did somebody call you a know-it-all as a kid?
All the time.
Okay, so that's why.
Good Lord, all the time.
That's why. Yep. So when I was a kid, somebody called me a know-it-all, and I remember thinking, I had to be 7 or 8 because that's where I feel like most of your memories as a kid kind of start, right? Unless people showed you pictures, then you have some artificial memories, right?
True.
So like I had to be 7 or 8, and I remember being like, "You're right, I am a know-it-all. I know lots of things. I'm gonna always know lots of things."
And y'all just love it too. Y'all just bathe, y'all bask in y'all glory too. When y'all see something and that little thought, I can see it in your eyes. Where it's like, oh, ping. Yeah. I'm about to tell them something.
It's nothing like getting a fun fact off. It's like, ooh, fun fact.
Fun facts.
I call it dad mode for him. I said, you're going into dad mode. You're just telling me about weather and random facts. Like,
yeah.
I said, appreciate
you, bro. We're really, you want us on your trivia team.
100%.
Oh, yeah.
I ain't going nowhere. Any road trips or anything, y'all will keep the conversation going.
Yeah.
So I love that.
Yeah, and to go back to Calvin's story, what's so interesting about your story about turning 26 is had you come of age just a few years earlier, you might have been doing that at 18 or 21. For the Affordable Care Act that extended that to 26.
That is true.
Wow. That's crazy.
And because that's how we've been living for the last decade.
Exactly.
We don't remember that.
Yeah, it just flies over our heads.
You don't even know about that.
I didn't even know that was really a thing until later in my life. After I was like, same thing. My mom's like, you're lucky that you could be 26 on this plan.
Exactly. And still have it. I remember my dad was still telling me too. He was like, man, listen, I know you ain't got it right now, but I was planning on you to be off my policy. Because my dad was still paying my copay.
Oh, yeah.
Well, thanks, Dad. Shout out to your dad.
Shout out to Pops. Love you, dude. So we kind of want to talk about, where did insurance, even the thought of insurance, even come from? I mean, for me, I see myself paying this money every single month. Going into a pot. Like, how did this start and why did it start?
Okay, so let's talk about how health insurance in the U.S. started, because insurance as a concept has been around for a super long time. And so let's talk specifically about health insurance and in the U.S. context, where essentially a group of people, and the story I want to tell that my favorite is to tell is a group of school teachers in Kansas. So imagine, 100 years ago, folks getting most of their care from a home visiting doctor, right? There are hospitals, but they're kind of rare, they're kind of new, they're kind of small. So most of your care is coming from a doctor who is doing house calls, coming to check on you. You call the doctor, you send somebody on a horse to let the doctor know you need care. The doctor comes back on a horse. And so this group of school teachers had a coworker who'd gotten really sick and so wasn't able to work. And there weren't any social insurance programs yet, right? No Social Security, no disability benefits, no health insurance. And
that methodology wasn't even a thing for the community to kind of even grasp at that point.
That's right.
Wasn't even happening.
And so communities just did it on their own. So this group of school teachers said, well, we know that, so-and-so can't work. His family still needs to eat. His family still needs to be able to live while he recovers, hopefully, from this illness. So what if we all put a little money in to help pay the doctor, to help give his wife a little money so that she can, buy food for the home. And then they were like, actually, that worked really well. So what if we just all do this all the time? Every month from our salary, we'll all put a little bit in the money. And then if somebody has a need because of their health or an injury, they can take out without being worried that they're going to just ruin their situation.
Right.
They won't be able to live. Their family won't be able to survive. And, that they might have that time without working where they're not making any money. They still can get their basic needs.
Yeah. While being stressed. Ultimately,
yeah. And so it really is this social contract where people are coming together, putting in a little bit of resources on a large scale so that when someone has an illness or injury, they can go to the pot, pull some money out to take care of that illness or injury. So it's really beautiful.
That is. And back in that time, there had to be a lot of trust involved there. But you also knew, though, like, if I do take from this pot, I may not have nothing if I want to take care of my own health itself. So to have the trust there on a community perspective is good to see back then. Mm-hmm. So here they are putting this money into this pot, and everything's kind of going well, I assume, for them to then keep this process going for a longer period of time.
And then as things kind of grew and got more advanced, and, you know, depending on your perspective, then it's like, well, we can, instead of just putting kind of in the pot that Mary keeps in the schoolhouse, we can, you know, start to just pay a hospital or pay a doctor. We'll give him the pot of money so he just can pull from it when he needs to, when one of us needs
and cover all of us.
And then, you know, fast forward 100 years, we've added all types of complications and enhancements and things to make sure that insurance is doing what it was intended originally to do, which was basically help a lot of people without a big cost to each of those people individually, so that in case of an illness, an injury, even sometimes in the case of death, when we're talking about health insurance, that they don't face financial ruin. And then Medicaid and Medicare specifically was a major legislation in 1965 as part of the Social Security Act, which had been attempted earlier in the 40s on the heels of the Great Depression, because elderly were so much more likely to be indigent, to be unable to work, unable to care for themselves, and to be highly dependent on their adult children for their very basic needs. And were also people over the age of 65, again in the 1940s, were also the largest group of people using hospital services, which were really expensive services.
That's where that Social Security needed to happen to cover them in that basis when they hit that age range or risk range for them at that time.
For their health.
That's interesting.
Okay. And so in the 40s, it didn't get enough social will, political will to pass. But with all of the civil rights movements of the late 50s and early 60s, there was an opening to where there was a conversation around, well, what do we need to do to make sure that our most vulnerable populations, up to and including Black people, up to and including immigrants, up to and including our elderly, have some safety nets so that we can be in a better place in the country. And that's where Medicaid and Medicare came along.
Really?
Where it was a healthcare program for the elderly, Medicare, and a healthcare program for low income, Medicaid.
100%.
Thank you so much, Dr. Bishop, for taking the time to kind of give us an overall view of, you know, the start of insurance, you know, where it all came from, how it was utilized, so on and so forth. I think that was what we'd like to call Insurance 101.
100%.
And we do have a separate segment to speak on Medicare. But this segment here, we wanted to dive in a little more about Medicaid. Let's leave it at that intro. If you want to dive a little more about what is Medicaid.
Yeah. So Medicaid is a government insurance program, usually for individuals who are low income. Now, that includes millions and millions of children, because thanks to labor laws, most children do not work. So they have very little income, usually none. And so Medicaid actually covers millions and millions of children and makes sure that those children are able to have access to regular checkups, important tests, important screenings, to catch things in their development along the way so that they can have the best shot at growing up to be healthy adults one day. And so Medicaid started in 1965, just like Medicare, as part of the Social Security Act. And it was a way to, again, protect the most poor people in our communities from the downfall of bad health, not only by providing preventive services so that they could prevent bad health in the first place, you know, having access to care, being able to see a doctor, being able to get a dental checkup for pregnant women, for pregnant individuals, being able to have prenatal care, to be able to give birth in a safe and clean environment, to have checkups for that new child. Because as a society, it actually does absolutely benefit us to have children and pregnant people be really healthy.
100%. It
Right?
does.
Right? So Medicaid is a program that helps to do that regardless of folks who may not have otherwise been able to afford other types of insurance. So the Medicaid program allows folks who have low income or no income to be able to still have health coverage through a government program. And this is really important because we know that poverty is already a risk factor for health. That not having enough money probably means you don't have enough food, probably means you're not eating well or enough. Might also mean that you live in a community that doesn't have opportunities for exercise. And so, or that might be impacted in a disproportionate way 100%. By toxic waste or pollution or crime.
And that's where those social dynamics, social determinants of health will come into play.
Because those things frequently come together. And so by providing health insurance to folks with all those things, at least gives them a shot at having access to health care, preventive care, and then to solve health issues or injuries early so that they have a good shot, especially the younger people in our population have a good shot of growing up to being productive members of society. Now, I know you all have parents, so I'm sure you've heard about being a productive member of society. 100%. In this context, we mean someone who is able to contribute to society, whether that means by being part of the workforce, by being part of the volunteer force, by raising their family, by contributing to their community, right?
You hear so many negative things sometimes surrounding Medicaid. There's a negative connotation to it, right? Like you aren't being a productive member of society, and that is totally not true.
That's right.
That is totally not true.
Yeah.
Like she said, there are so many factors that go into that piece where you may be working a job where they just can't offer insurance, and you're working every day, 40 hours a week, 80 hours a week. A lot of times people that have Medicaid are usually working more hours than those that have those commercial policies. So I want to demystify that concept and just the overall negative connotation around Medicaid, because that's so many benefits that we're going to soon get into here. So.
That's right. And the great thing about one of the things that the Affordable Care Act also did a really good job of doing that some of the other tries at health reform in previous decades didn't do as good of a job of doing is kind of making more and more people eligible for Medicaid, meaning that more types of people were going to be using Medicaid, right? And, we talk about diversity in all types of settings, but this is one of those ways that diversity, again, really makes a difference because, for instance, when I used to work in Washington, D.C., Washington, D.C. is one of the state Medicaid programs that has the most wide eligibility. And part of the reason it has the most wide eligibility is because they recognize that there are individuals who might have actually really well-paying jobs, but rent is really high. And if folks want to stay in the city, they want to invest in the city, they want to still be a resident of the DC, and they make what on paper might look like a really high income, but they have 4 or 5 children and are paying really high housing costs, that health insurance piece can make a big difference in them being able to stay in the city.
Right.
Because now they're taking that health cost risk off the plate, making sure that the children in the household have access to health care so that they can prevent getting sick in the first place or have it resolved if they have an illness or injury. Right. And so it's one of those things where it's like, in DC, you could have a family on Medicaid that has been a 6th generation government assistance family, right? Folks who've been in poverty, haven't been able to get out, haven't been able to get educated, haven't been able to work and kind of get a foothold and climb up, right? Pull themselves up. But you also have lawyers and physicians who, because the math worked out, they are also eligible. But guess what? When you have really highly educated people who have maybe even had commercial insurance in the past on a Medicaid program, they start asking questions and make the program
more progressive and inclusive.
Better.
Yep, 100%.
Better. And so this is a situation where diversity actually really helps. So when the Affordable Care Act made more and more people eligible, meaning that more and more people were going to be participating in the Medicaid program, people who had commercial insurance in the past or who were really knowledgeable about this stuff start asking questions, and it made the Medicaid program kind of step its game up.
Yeah. Put some respect on the Medicaid's name. You hear me?
That, truly for me, that.
For real. Yeah, and we kind of touched on those
that.
Economic benefits because, like, if you're in a city or if you're in a county or a state and you're looking at, the economic benefits of being in that state, Medicaid and how accessible they're making it can show the intentionality that they have to be more progressive in that place or setting. So
That's right.
it's good to know that when you're looking at the space that you're in, that's another part of being self-aware.
Yep.
And knowing what is truly accessible to you. So I'm glad you broke it down in that way, because that's where I took it. I'm like, okay, now I can really see another side of where, you know, where I'm staying and what are they paying attention to overall.
But I realized I didn't actually answer your question. I answered the question I wanted to answer. So let me go back and actually answer your question.
Sure,
you asked
bro.
me, well, like, what is Medicaid? So it's all this stuff I just told you about. And one of the most basic definitions that I want to make sure people understand is Medicaid is a government health insurance program, and it's a state and federal partnership.
Okay.
So when we were on the other episode, when we're talking about Medicare, Medicare is all federal.
Yep.
All federal. Like pretty much if I'm in Ohio, if I'm in Michigan, if I'm in California, it's pretty much all the same. But in Medicaid, each state gets to decide up to a limit. There are some minimum benefits that have to be covered, a minimum list of things that have to be covered with no co-payments, no out-of-pocket cost. But states get to decide who is eligible. States get to decide which programs and services they're going to include. And so the programs I'm most familiar with, Michigan's program and DC's program, are actually really different in terms of who's eligible, in terms of income limits, and how long children can be on the program with or without their parent or guardian, and then also which coverages are included. And so for our listeners in Michigan, your eligibility is really different from our listeners who might be in Ohio. And so it's important to pay attention to that. If you are not sure whether you're eligible for Medicaid, you have to pay attention to the state you live in or are a resident of.
Okay.
Where can you find those eligibility requirements? Like, is there a state website?
Every state has a state Medicaid agency. Each state calls it something different. In Michigan, it's called the Department of Human Services. So the same place you go to, and y'all gonna know my age here, the same place you go to apply for food stamps, now better known as SNAP, the same place you go to apply for TANF, this is the same place you also apply for Medicaid coverage. And so that same office, that same website is where you can go to check eligibility requirements. And then there's all types of government websites like Medicaid.gov, where you can search and it'll bring you to the Michigan page if you had a hard time finding it.
Gotcha.
So that's the big distinction between Medicaid and Medicare. So even though Medicaid and Medicare are both government issued insurance policies, Medicaid is the partnership between state and federal, right? To then carve out a more individualized plan for each state,
right,
for lack of a better term,
right?
Yeah.
And that's because the way our government is set up, like since states have to pay for so much of it, they can say, well, the way our budget is set up, federal government, is we're going to set it up this way.
I see.
We don't got California's budget. So Michigan's going to set it up this way.
So I understand that each state has specialized requirements in terms of like a minimum coverage. How separated would the Medicaid experience be state to state?
It can be real different.
Okay.
And so let's say like high coverage, medium coverage, low coverage.
Sure.
So a high coverage state would be like DC or California, where lots of things are covered with really, really minimal, in DC specifically, zero out-of-pocket cost.
Okay.
If you're Medicaid eligible and it's covered by Medicaid, nothing is coming out of your pocket. Michigan's probably in the middle, where lots of things have very low copays, like $3 for medicines or $5 to go to the doctor. So there's still a little bit of money that comes out of pocket, but a really small amount, right? And so that's good, right? So you're not pushing people out or disincentivizing people who we already know have low income because they were eligible for Medicaid from going to take care of their health. But they do got to bring a little something to the table, because Michigan doesn't have DC's budget. Michigan doesn't have California's budget, right? Right. And then you have states like Texas, where they are not an expansion state. They decided not to expand eligibility for through the Affordable Care Act, meaning that fewer people are eligible in the first place. And the people who are eligible have to meet a lot of requirements to keep their benefits. And they have some other requirements, not necessarily out-of-pocket requirements, but sometimes drug testing requirements, sometimes work related requirements. And so it's kind of like there's a range of, how easy it is to qualify for Medicaid by state, and then how rich your benefits and services are by state.
Right.
So the experience, it seems, can vary quite a bit.
Quite a bit.
100%. You can see some red tape in some other areas or states, and that's good to know. 100%. So we talked about Medicare and Medicaid, and Medicare has an enrollment period usually for like October. Is it the same thing for Medicaid, or can you kind of apply for Medicaid at any time?
Yeah. For Medicaid, you can apply at any time.
Okay.
You can go down to the local DHS office, or you can do actually 100% of it online on the website, which is new, because they recently updated. So new, the word new, mibridges.gov.
Okay.
And this is the website that it's a one-stop shop. So this is where you apply for Medicaid, but also they use that same information to see if you're eligible for food stamps and for TANF.
Okay.
Okay.
Is there anything that you kind of should have like kind of prepared or kind of have paperwork-wise ready or brought to the table before you go to that process? Because you don't want to get to the office and there's paperwork involved. Now you got to leave the office and come back. Do you know what those requirements
Yes, so
are?
you need proof of your identity. So like an ID. So a state ID, a driver's license, some school IDs also work, birth certificate. You do need proof of citizenship or legal immigration status.
Okay.
So if you have a passport either from your home country, which might be the U.S. or somewhere out of the U.S., if you have a birth certificate, and then you need proof of residency. So you have to prove that if you want to be on the Michigan program that you actually live in Michigan.
Right.
That makes sense.
Right.
My man's out of Ohio trying to get these Michigan
Right, because
benefits.
he heard that Michigan was better. No. So you have to prove that you are, in fact, a Michigan resident to get the Michigan program. So you can usually do that through a piece of mail or even an online bank statement that has your address on it if you don't really get a lot of mail. And you have to prove your income. And you can prove your income a bunch of ways. Most people usually bring a couple pay stubs if they are a working person. If people don't have easy access to pay stubs, or maybe they aren't a working person right now, they can bring like a tax return from a previous year.
Got you. So you can pull on your tax return to be able to show that as well.
And when you go to if you are doing it all online, it gives you an electronic checklist and you can upload it right into the system.
Okay.
There's even a phone app. So if you can get the stuff on the phone, because maybe that's the way you use the internet the most, you can do it from your phone.
Gotcha.
And then if you go to the office and say you've forgotten something, they also will give you a paper checklist and instructions on how to either mail in or upload your materials.
Those documents. Okay. And that portal saves that information. So you can come back to it, log into your portal or profile, and start making those connections to complete your process.
That's right. Okay. And I actually have to take a small commercial break here and talk about something that's really important that's happening in Medicaid. So during the pandemic, the federal government had said, hey, we are in the middle of a health situation. So all you states, we are not going to be kicking people off Medicaid during a global pandemic. So states, we are saying it's a public health emergency. Everybody is presumed to be eligible. If they were already on Medicaid, you leave them there until we say you can start to check them again. And so anybody who has had Medicaid over the last 3 years, they have not had to submit proof of income. They have not had to submit proof of residency for the last 3 years because the federal government said, yo, we're in the middle of a pandemic. Let's not kick people off Medicaid. That's not the right thing to do right now.
We need people going to the doctor.
Right. That's not the move. But that has now ended. And so people who might have been on Medicaid for the first time might not even realize that they have to turn the stuff in because they haven't had to do it for 3 years. And so if you or someone you know has Medicaid, make sure that you're calling your caseworker or at very least checking the mbridges.gov website to see if you need to do something to reactivate your coverage. And by reactivate, I mean renew, basically just confirm, yep, I still live in Michigan, and yep, my income still qualifies me and or my children.
So I understand there was this lofty period where none of that was required. Now that we're, past the pandemic here, what kind of requirements are there on the year to year? I know Medicare, you have to follow up every year to make sure your policy is the same or if there aren't any changes. What does that process look like for someone that's utilizing Medicaid?
Yeah, so it's not all that different. basically once per year, usually on your anniversary date.
Okay.
So when we were talking about Medicare, it's this period at the end of the year. For Medicaid, because you can apply it any time in the year, you have to renew around that same time. It's kind of like the birthday of your Medicaid approval. So if you got approved in August, then probably around August of next year is when you'll need to turn in all your stuff.
Okay.
And that's again, because in order to have Medicaid through a state, you have to prove you live there and you have to prove your income to make sure you're meeting the eligibility requirements. And a lot of stuff can happen in 1 year, let alone 3, right? So somebody who applied and had Medicaid 3 years ago, they might have added a new child or 2 in that time, right? They may have moved. They may have lost a family member to COVID or something else. So their family size might be different. They may have changed jobs or lost their job. There were a lot of industries that folks still have not returned to work at because they just haven't been able to. Right. And so if you can think about all the things that could change just in 1 year of your life and multiply that by 3, it's really important that people go submit their proof of address and submit their proof of income so that they can keep their benefits. And many states, Michigan included, have done all types of things to make sure that if for some reason you are no longer eligible for Medicaid, which does happen because maybe you are making more money, maybe one or more of the children that was living with you are now adults, and so you instead of having 5 people in the house, you only have 3 people in the house, right? So in case any of that has changed, they have made it really easy for any of the information you put on M-Bridges, on MI Bridges, to go into the marketplace so that you can go and pay for a plan, really low cost plan without you having to do the paperwork all over again. Because they saw during the pandemic, as we've known for years and years, that health insurance actually really does make a difference in people's health, in their finances, in their ability to be a student, in their ability to work a job, even if it's not one that is able to provide them with health insurance. That health insurance is one of the ways that we can really stabilize people's life situations. And so they're like, let's not mess that up.
Sustainability is my biggest thing. And like, even looking at every decision that I make in life, it's like, how sustainable is this going to be? And to the Medicaid point, it definitely is going to stabilize you, to give you the ability to live and thrive through your life. For Medicaid purposes, is there like a limitation on how many children you can have?
No. Like, I mean, I don't know.
No, not a limitation on how many children you can have, right? But like how many children you can have covered, or your immediate family. Like,
no, if I got 9 kids, I got 9 kids.
9 kids. Okay.
I mean, you might have to, you know how some forms you fill out and it's like, use a blank page if you have more than 10 children. So you might have to fill out an extra form.
Page? Okay.
But if you literally have 9 kids,
it will all be covered.
Then you got to put it on the form.
On the form. Okay.
Now I want to drum this point into, just for our viewers' sake. So your insurance policy should be reviewed yearly, regardless of whatever insurance policy you have
That's
or
right.
health coverage you take.
That's a good point to make, bro.
That should be something that should be reviewed yearly. Yeah. And I want to bring up another touch point, or something that you brought up earlier, is know your deadlines. You got to know your deadlines, right? Your dates and deadlines, right? So if for Medicaid, that date or deadline is usually around your anniversary, whatever month you got approved in the first place, right? But if you have private insurance, it might be, a certain month in the year, because that's when your company does the program. If you have Medicare, it's that certain point in the year, the annual enrollment permit. So, know your dates and deadlines and check your stuff once a year. Absolutely.
Just check it. Make sure it's the right thing.
Definitely. So you would say, if you're moving out within years or something like that, you can do the change of address form with the local post office. Usually costs you $1 to have all your mail forwarded from all your previous addresses to your most current. So that way, if they're sending mail for your Medicaid to be updated, you want to make sure that you're letting the systems at play know, like, hey, I moved to a new place. So you can get the chance to actually get those updates in.
That's right.
So,
and if you use an email address, that's even better, because, data shows that while people may change addresses 27 times over the course of their life, email addresses are actually really stable.
Yeah.
Like, I bet you still have a email address from when you were 12. I'm not going to ask you what it is because it's probably embarrassing.
I'm going to just disclose it here just because I think it's hilarious. I'm a skateboarder, or when I was younger, I was a skateboarder. It was Skateaholic 2468 @AOL.com.
And you still have that email address. You still check it. You probably still get coupons.
Still on
to
my
it.
Apple, my iPhone.
Yeah, exactly. So that proves my
yeah.
point, right? You've had that access to that email account for 20, well, maybe not quite 20 years, but how many times have you changed your address in that time, right? So that's why it's really great that if you have access to the internet, whether on a phone or a tablet or a computer, that you get hooked up into these online systems. Because while your address change might change 3-4 times in a year, your email address probably is not going to.
Yeah. That's a good point. Great point.
Is there just one Medicaid plan? Like when you go in to apply, what type of options do people have to look at, and what things should they be looking at in that process of getting approved for Medicaid?
Yeah, so in Medicaid, in the state of Michigan, when you get approved, they say, congratulations, you've been approved for Medicaid. You get a letter. If you did it online, you might also get an email notification. You actually have a period of time. In Michigan, I believe it's 90 days where you can go and say, I want this plan or this company over this company. Now, in Michigan, they do it by county. So if you're in Kent County, you probably have 4 or 5 options. If you're in Wayne County, you have actually 6 or 7 options just because it's a more populated place. So they have a few more companies doing things in that area of the state. And so if that 90 days passes and you don't pick, oh, I want Priority Health or I want the Blue Cross Complete, then the state will automatically assign you to one so that you are with a health plan. Because Michigan, as most states have decided with the Medicaid program, they said, look, Medicaid can work in a couple of ways. Like if I have a Michigan Medicaid program, all the doctors and hospitals can mail all the bills to me. And as the state, I can write all the checks for those bills. Or I can get a contract with a health insurance company who's really good at managing health insurance, pay them a certain amount and tell them, here's your budget for the year, make it work. And then they put together the things and they manage the care and they say, Cal, we noticed that you haven't been to the doctor for your diabetes. Let's get you into the doctor for your diabetes because we want to make sure that your diabetes is being well cared for because when you're healthy, so are our pockets, right? It's one of those things that actually win.
Exactly.
Like you being healthy is good. And so it's like, it's one of the things where it's like, wait, it's a real win-win. And so to answer your question, there are lots of options for Medicaid in Michigan. And so once you get approved, it is good to take the step to kind of look at, oh, maybe I want this plan because the doctor we used to see, or a lot of the doctors that's easy for me to get to that I can either walk to, or I know there's the bus that stops right in front of that doctor's office are easy for me to get to. The good news about Michigan's Medicaid is the co-payments are pretty much the same no matter who you have. So that part isn't something you have to think about as much, like how much out of pocket am I going to pay, because that's pretty much standardized. But that's what might be the difference is that maybe this plan has some special programs. You know, maybe I have a child who's on the autism spectrum and I want to make sure that in addition to the regular therapies that we can do some cool stuff like play therapy or physical therapy.
And you can really dive deep and just ask straight up, like, y'all have questions. These type of therapeutic services available pretty much. You can go through savvy, like a list.
And if you're savvy or you're on the internet all the time, you can even just look this stuff up because they are required to have their benefits books online and accessible. You don't have to have a sign in. You don't have to log in. So if you're trying to compare 2 plans, you can say, okay, well, I'm going to look at this plan. Oh, they do have this special therapy that I want my child to be able to participate in. Or this plan, it looks like they have it, but they don't have that many doctors in my neighborhood. So it's better for me to go with this plan. And the Michigan Enbridge's website also has a comparison chart. So if you don't want to have to do a lot of the work and looking really close, there's only a couple things you can. You can just look at the high level comparison chart.
Oh wow!
So there's definitely
easy. The resources are there.
Yeah, there's definitely a ton of resources to utilize. That's good.
On my end, keep this thing going. As far as Medicaid versus Medicare, when you have your policy, you've been, doing what you need to do. Can you make changes to this policy at any time?
Yes.
Or do you have to wait till your anniversary date comes around?
Medicaid actually has some more protections in it because earlier in the program, we noticed, these are poor people. And I don't mean that in a pejorative way.
Really,
right?
yeah,
But it seems like some things people are being taken advantage of. And so there actually have been a lot of things built into the program to help to prevent and avoid that. So one of the things that is part of the program is that if you don't feel like the plan you selected or that you were assigned to is doing what they're supposed to be doing, you're not getting the services you need, you can change. and you can change usually once per month.
Oh, wow.
So it's not necessarily a good idea to do it once per month, but you can.
You can do it.
You can do
Good
it.
to know. I didn't know that. I thought it'd be like the same thing as Medicaid. Like you'd have to wait for that anniversary date to come back and make any of those changes. So that is amazing to know on my end.
Now, each state has slightly different rules, but that's how it works in Michigan.
And you can always check the website for your state and talk to your caseworker to get those updates on when you can make those changes.
I feel like after that deep dive, I mean, at least I know quite a bit more about Medicaid, and I'm sure the viewers appreciate everything, the knowledge that you were able to spit today. But just for closing remarks, I wanted to ask you one last question here. Is there anything for anyone interested in Medicaid or looking into the process that should know, a non-negotiable that they should know about this whole process?
Yeah, that is not as hard as you think. That, applying for Medicaid benefits, you just need a few things. You need proof of income, proof of residency, and proof of identity, which also part of your identity is whether you have a legal immigration status.
Okay.
And so like your birth certificate or your passport. But that's not that many documents. Most people have access to that.
Yeah.
And there are lots of ways to get help if you're thinking about applying for Medicaid or any other health insurance program. And so if you feel like it's going to be too hard, don't let that be something that stops you from getting access to care that can make a big difference in your life, especially if you have young children or if you've been managing a health condition, because having regular access to good, high quality medical care can catch things early so that they don't become big bag of health problems, can solve problems quickly so they don't become big bad health problems, and can help kids and young people especially kind of get into really good habits from a young age of taking care of their bodies, because we only get one.
That is true. That is true. Well, I appreciate you for that. Thank you for, leaving us with that gem, because I mean, if you didn't take anything away from what Dr. Bishop was able to say, is health coverage is something that should be a non-negotiable for really anybody in their life journey. It should be something that you take advantage of, especially since there are a lot of programs, or there are programs backed by the government that give you the services, the health resources that you need to live a fruitful life. So I think with that being said, that's kind of a wrap on the podcast. We got a really inclusive look at what insurance as a whole looks like. We got a dive into what Medicaid looks like in Michigan in particular. And then please follow us on all our posts and all of our marketing materials here, as we will continue to link the viewers and the audience with a lot of resources that you can utilize as you go through your healthcare journeys. And I'm sure Darla will help us create that list so we have an all-inclusive one-stop shop for you on this podcast, as well as tangible, readable materials that you can take advantage of online and during your own spare time. So again, thank you so much, Dr. Darla Bishop, for being here on our podcast. Again, it's Curated Conversations with GRAAHI, and that is a wrap.